Hey all, Azim here. We are looking at two humeri, or singular, a humerus. Let's figure out which way is which, and then we'll go over the different parts. Or I guess we'll do both at the same time. All right. Our first important thing to look at, is the head. The head of the humerus is proximal. So this is the proximal end. Remember, when we use terms to describe things on the limbs, we use proximal and distal, not superior and inferior. This is the proximal end with the head, the nice round head. The distal end has all these bumpy protrusions we'll go over in a minute. Proximal, distal. The head is going to point medially. The humerus connects to the glenoid fossa, the glenoid cavity, medially. So the humerus here, this is medial on this side. Medial, lateral, proximal, distal. One other important feature that we can see on the proximal end, you'll notice these two bumps. There's this bump here on this side, and then another bump here a little to the lateral part. If you look on the other side, we don't get that as much. There's a nice big protrusion right here. This is the lesser tubercle. This is the greater tubercle. These tubercles point anteriorly. So this is the anterior side. Some more things that can help you figure out what side is which. You've got two protrusions on either side, lateral and medial. The medial one is much bigger. This is the medial epicondyle. This one, medial epicondyle. This is the lateral epicondyle. Medial epicondyle, lateral epicondyle. What's also pointing medially is this rounded protrusion. It's kind of sharp, but if you look at it from this side, it's very round, looks like a pizza cutter. This is called the trochlea. Trochlea means pulley. This is to help pull your ulna for your elbow joint. Helps you pull your ulna up, and I'm trying to get the right ulna. There we go. It glides along that pulley-like shape. That's, again, the trochlea. The trochlea is medial. This other rounded one, this is head-shaped. The word for head is cap. This is the capitulum. Capitulum. Capitulum is lateral, trochlea is medial, medial epicondyle, lateral epicondyle. Head is medial, lesser tubercle is anterior. This is the right humerus. This is the right humerus. Here is the left humerus. Again, tubercle pointing forward, trochlea pointing medially. Here's the posterior side. One thing I want to point out on the posterior side, this is called the Olecranon Fossa. The olecranon, or the olecranon process, is your elbow, the pointy part of your elbow. So when you're bending your elbow, the ulna needs to go into something. So you have this fossa here for the olecranon process of the ulna to fit in. So you can see that on a full skeleton. Here's the humerus. There is, there we go. There's the ulna going into the Olecranon fossa. Olecranon process of the ulna going into the Olecranon fossa of the humerus.